morning and welcome to the fourth Elets Pharma Leadership Summit. The COVID 19 pandemic has brought about an accelerated transformation in the Indian pharmaceutical sector. With technology engulfing the entire gamut of the pharma universe, the wide ranging transformations have unlocked new opportunities. With the government classifying pharmaceuticals as a sunrise sector in Budget 2022, new vistas of support have opened up. Unraveling the road ahead for the Indian pharma sector, Elets Technomedia, along with eHealth Magazine, welcomes all our esteemed speakers, partners, and delegates to the fourth Elets Pharma Leadership Summit 2022 on the theme Transformation Through Disruption. Carrying forward the legacy of the past three editions, the day long summit will look to take the discussion forward on what lies ahead for the Indian pharma sector. And to take the discussions forward and welcome our August gathering for the inaugural session, I would hand over the platform to Dr. Ravi Gupta, CEO and Editor-in-Chief, Elets Technomedia. Over to you, sir.
Thank you, Garima. Welcome all our esteemed speakers and esteemed delegates who have joined on our platform. I'm Ravi Gupta. I'm Editor-in-Chief of eHealth Magazine. I'm also the Editor-in-Chief of Digital Learning Magazine, eGovernance Magazine, and also Banking and Finance Post magazine, published by Elets Technomedia. We are an 18-year-old organization. We have been working in this field of driving innovations, building platforms for innovations and knowledge sharing in the various sectors. And we have been publishing this eHealth magazine since the year 2005. And one of the important sectors which we have been focusing is pharma. And as we all are aware that pharma is a sector which has emerged as the most important sector in the last 2 years due to COVID. And India has been recognized as one of the most important pharma R&D and production centers globally. And Indian pharma companies are making new drug discoveries, doing new innovations, and doing new R&D in various sectors of the pharma, and India is on the path of becoming one of the most important pharma hubs of the world. So, in this background, when the COVID spread is reducing and the pharma sector is consolidating, we are holding this fourth edition of the Pharma Leadership Summit. We have our esteemed speakers here with us. We have with us Dr. H.G. Koshia, who is the Commissioner, Food and Drug Control Administration, Government of Gujarat. Koshia ji, namaskar and welcome. Thanks for joining us.
Thank you.
Namaskar. It will be great if you can switch on your camera and be on the screen. So, thank you. And welcome, sir. Welcome. Thanks for joining in. We are honored to have you with us. Namaskar. Dr. Subhash Mandal, who is the Vice President and Chairman, Regulatory Affairs at Division, India Pharmaceutical Association. Welcome, Dr. Mandal. Thanks for joining us.
Thank you.
Namaskar. Namaskar. We have with us Dr. Sharing Shah, who is the Director and Chairman of the Indian Drug Manufacturers Association, Gujarat State. Dr. Shah, welcome on the board. Thanks for joining in. And with us, we have Mr. Jay Seelam, who is the Vice President of Industrial Pharmacy Division, Indian Pharmaceutical Association. Welcome, Jay Seelam ji. Thanks for joining us. Namaskar to you. Honored to have you.
Good morning.
So, good morning. And let me welcome all our esteemed speakers and esteemed delegates who have joined us on our Avatar platform, which is our 3D platform. So we will start with a brief opening remarks from each of our speakers, 5 minutes each, and where we request each of the speakers to, especially as I mentioned about the last 2 years, how the Indian pharma sector has transformed, and how are you seeing the road ahead. So if I can request Dr. Ajit Koshia to give his opening remarks. Koshia ji, over to you.
Very good morning to one and all. Thank you, Dr. Gupta, for nice introduction. And my colleague on the board, Mr. Nishant, the ID Minister, Mr. Gujarat, Suresh Bandarji, IPS Talwar, Jayesh IPS Talwar, and rest of the learned speaker and different session. Friends, we have been passing through this COVID era since 2.5 years, and there is a lot of transformation and disruption. Yes, transformation is a welcome state, and yes, it's really required, and it's must to progress in the faster way. But yes, disruption. Sometimes it's advantage, and sometimes it's damaging society as a large. If I'm speaking to healthcare industry perspective, farmers perspective, yes, and thanks to Elets for motivating my team for recognizing our e-governance initiative early in this 4 5 years back, online licensing software and everything. Right now we are meeting on a virtual platform again, thanks to the technology and transformation. Otherwise, we used to meet physically in person, either in Bombay or whatever part you are running these events. So that we have to travel a lot. We have to put extra time, and for speaking for half an hour slot, we have to spend that whole day. But thanks to this technology and transformation, because right now, without wasting much of time and without costing travel cost and comfort, I think we are meeting face to face through virtual platform. So transformation is very much required. If we look back to 2.5 years, we hardly have a meeting virtual platform. Today we are meeting virtually and frequently. If I am talking about the FDA perspective, previously I used to travel every fortnight to Delhi or some part of India to attend some or other official meeting or some technical session. But right now, every day, almost within the state, intra-state, and national level, and with the government India, mostly 2 to 3 times we are having a meeting with a different department on virtual platform through this digital technology. So this transformation has positive impact on our ease of flying, ease of communication, and ease of our work. Yes, same way it has also impacted at large in the society, in the healthcare sector, in the pharmacy sector. Yes, because of this COVID pandemic, there was a lot of disruption. If I'm speaking of the disruption of the supply chain, so as India, we are depending a lot on the import of the import APIs, these starting materials, and basic chemicals from the neighboring countries. And because of the lockdown and the seal of the border, and I think it was a little bit difficult, and we were worried that how we can cater the pharma need of the people who are continuously on the treatments like diabetes, some like disease like cardiac care, and many more. Even during this pandemic, because of most of the medical practitioners, they have shut down their hospitals and the clinics. So there was no generation of the prescription. So prescription sale was hampered, the pharmaceutical production hampered, the supply chain was disrupted. But yes, as a whole India, as a pharma industry, as a regulator, as a government, we supported each other, and yes, we could come out with this crisis time, and we have not met only our need of the local, but we as a pharmacy of the world, rightly mentioned, India is already established as a pharmacy of the world, and we have supplied a lot of generics to the many countries, whether it is hydroxychloroquine, it's paracetamol, even vaccine. Again, this transportation, artificial intelligence, and yes, India has come out with this two COVID vaccine indigenously prepared, and within a no time, yes. Otherwise, to prepare a vaccine, it's almost decades process. It takes 8 to 10 years to develop, to test, and to put in the market any vaccine safely. But yes, thanks to our scientists who are working day and night, and thanks to our visionary leadership, that and yes, that emergency use authorization, we have hardly come about this word emergency use authorization of any medicine or the vaccine. Yes, but US FDA has used that tool. In the same line, in a regulator also use that same tool, emergency use authorization, if any innovative drug or vaccine, which is 100% safe, but efficacy it's more than 50%, then it is considered under the category of the EUA, that is emergency use authorization. And as you all know, that our vaccines almost 60 to 70%, 80% efficacy, and regular cleared it, and which has catered the mass immunization, and we could survive our most of the population, other than the vulnerable, in this two peak of the pandemic, peak 1 and peak 2. Yes, this because pharma industry again is a technology-driven industry, it's science-based industry. Every day we have a lot of new things, new technology, new science. So we have to adopt, and we have to learn, we have to relearn. And yes, there are a lot of old practices we have to disrupt it, we have to destroy it, we have to garbage it. So let us speak about my organization. Previously, we used to issue the license in person, in hard copy, in physical form. But yes, thanks to the technology and the adoption and the transformation, my Gujarat FDC is almost 80% online, and most of our work is going to digital only. First, we are the state to start this excellent software to cater the need of the retail or pharmacy, to issue their license, to renew their license, to alert them about their forthcoming renewal, even to alert them about the not of standard quality medicine, and safeguard the public health. Again, we have enhanced and we have expanded our scope. Now we have in place the DMA software, that is the online license software for the drug manufacturers. Yes, we use this software during this COVID pandemic of the first wave, because the first wave we don't have any medicine, we don't have vaccine, we don't have remdesivir, we don't have a pyramid, but only we have hand sanitizers, mask, and the social distancing. So in Gujarat, being a capital of the pumps of the world, we have a handful manufacture of the hand sanitizer, because it was not in much demand. Only 150 manufacturers were there in hand sanitizer manufacturing, but they were not utilized it fully because it was not much demanded in the market. But because of overnight demand in the hand sanitizers, most of the manufacturers came to me, they applied, and during this pandemic time, we have rose 150 to 650 manufacturers in the allopathic, in the cosmetic section, or in the Ayurvedic section, and almost 8 times more manufacturers. We even product license. Previously, we have 150 manufacturers having almost 250 product license. But right now, we have 3,500 plus product license for the different variants of the hand sanitization. And all this we have issued during this lockdown pandemic period, where there is no transportation, no movement on the road. But yes, using the digital platform, online they have applied, and online we have granted the product license, and they have started their operation. And again, this we have from short supply to surplus, and using this transformation, the technology. So there are a lot of events where we have supported the industry, thanks to our industry players, because they also work very hard day and night. Because in the first pandemic wave of the COVID, almost there were lockdown, and the pharma production of the Gujarat-based company went down almost, it has fallen down to almost 30% of this capacity. But with the support of the industry player, with the support of the local administration and the update team, we pushed them, we supported them, we helped them to support transportation, the movement of the labor force, the catering side, the food suppliers, and we could make it to 85%, even though it was a lockdown period. And we can continue this supply chain of the essential life-saving medicine in the market, those who are in need. So again, as a update team, we have monitored about the oxygen supply of the 65 million people of the Gujarat. And Gujarat being in its state, there were almost 1250 metric ton per day medical oxygen production in the state of Gujarat. And there are a lot of demand from all of India, and Gujarat-based industry are forced to supply to neighboring states. But still, my team has managed it we're also using this forecast tool. So even during this second peak, during this last May, I'm speaking of 1 year back, in the May, the same time, the demand of oxygen in the Gujarat almost 1,200 metric ton. Production was mostly, it was equilibrium. Most of our time, our most of the oxygen on the road. Sometimes hospital, they are crying, sir, we have only 2 hours stock of the oxygen. Some say we have 6 hours of oxygen. There is a huge queue on the oxygen filling station. There is a huge queue on the oxygen plant. But yes, we could manage using this technology. And uh, there are a lot of good things. I think we have a lot of speaker from IPS awards like Subhash Mandal, J.S. Shilan. Yes, we have industry captain from Gujarat, Dr. Sadiksha, and a lot of CEO and the head of the industry. They are going to speak at that day. I will think that this will again give enlighten to the audience about the advantage of this transformation and this disruption of this technology. Again, I am thankful to the organizer, especially Dr. Ravi Gupta, for inviting me, and thanks to all the participants for listening me. Thank you very much.
Thank you, Dr. Koshiaji. Thanks for your opening remarks, and you have explained about the various digital initiatives of your department, which have been like really helpful for the industry. And Gujarat has emerged as the pharma sector leader. Uh, it was earlier also, but now also the this sector is going very well there. Let me request our next speaker, Mr. Jai Seelanji, who is the leader and expert in this sector, and he is the Vice President of Industrial Pharmacy Division, Indian Pharmaceutical Association, to talk about his impressions of, especially after the last 2 years, and how he's like seeing the road ahead, and especially in the context of the global situation where there is a conflict happening between Russia and Ukraine, and there are challenges still happening in China in terms of supply chain management. So, how are these things impacting the pharma sector in India, and how do you see the road ahead? Cecil.
Thank you and good morning, Dr. Ravi Gupta. Respected my fellow panelist, Dr. Koshiaji, Dr. Subhas Mantal, my colleague, Dr. Srinik Shah, my colleague in IDMA, and all other delegates here. A formal good morning to everyone. First and foremost, I appreciate Elite's Health every year, or more often, they are coming with the latest panel discussion. Even during COVID time, when the industry or when the country was shut down, they were active, linking various health professionals together. So once again, my appreciation to them. Coming back to Dr. Ravi Gupta has put a lot of, uh, topics before me. Yeah, in the past 2 years, yeah, we everybody know that it was a challenge not only for the pharma industry but for the entire country. Not only for the entire country, for the entire globe. And the healthcare professionals were 24/7 engaging in saving trillions and trillions of people life. When we are talking about healthcare, we all know doctors are the first person who is treating patient. Think about the situation of a doctor in this pandemic. When the pandemic started, the doctor's problem was really they are not knowing anything about the pathology or about etiology of the disease. They are not knowing how to treat this. Initially, they said no steroids. They tried multiple drugs, right? Right from hydroxychloroquine, whatever drugs available, steroids, azithromycin, whatever. Here, whatever a health professional is trying to do, a doctor is trying to do, the pharma industry was ready. The pharma industry was ready to support them with whatever medicine they wanted. That is the biggest strength I am seeing on the Indian pharma industry. Indian pharma industry not only supported the domestic doctors during this pandemic, they also had taken the burden or taken the pressure of supporting the another 150 countries who were depending on India during this pandemic. Even United States wanted a lot of drugs during this pandemic from our country, and thanks to the Indian pharma industry, it responded very well. During this pandemic, few disruption happened. That is the topic we are talking. By default or due to pandemic, lot of good things also happened. Something which is new in the industry. The first thing what is coming into your mind is my mind is there was a very good connection or interaction between the government and the pharma industry. The government, right from the prime minister, felt the importance of vaccines and other medicines, what India should opt to the world. And there was a direct interaction between the ministry and with the pharma industry here. Okay, not only between the pharma industry of, not only between industry and the government. Another most important thing I have noticed here is there was a very good connection between pharma industry and other pharma industry. It's they never felt each industry is a competitor. But the industries in India united together. We have seen not only the industry in India united together, international companies join hand with Indian pharma industry in making many disruptive drugs possible for the patients. Many antiviral drugs, right? Many antiviral drugs, patented drugs, was given for as a license, not an exclusive basis. Many multinational companies handed over it to multiple pharma companies of India, and Indian company responded well. We manufactured that and given to the society, not only to the India and also to the globe. This is something new happened. And even vaccines, there was a joint venture like that, and it was taken for over 123 countries, and over 600 million doses of vaccines were supplied. Not only this, you see our allied medical device industry. When the pandemic came, there was not handful of PPE kit manufacturers were there. Mostly the masks were imported in the first 2 3 months. What happened? How the industry responded? That's where the disruption comes. The technologies were available and we acquired it, or it was given to Indian industry because India was the only one country which can cope up to the quantum volume what is required by the humanity. As a result, technology was available, and within matter of 3 months, we have manufactured the PPE kit for the entire world, not only for India. So you take anything, you want to give vaccines, you need, you want to dose the entire public, and think about the disposable syringe. Everything what you need has during this pandemic, there was a challenge, but the Indian pharma industry excelled the expectations. Most importantly, in the supply chain, the vaccine has to go across villages and it has to go in a temperature proof packages and the transport. We manage that everywhere. That is where I said I have seen there was a during this pandemic time there was a very good unity between government, industries, and the community. Also between industries and Indian industry and multinational industry together. So these are all the things which has put India on the top, and we have not only sold medicine. I feel as a pharmacist and an industrialist, we are not trading or we are not selling medicines here. We are saving trillions and trillions of people life. That is what the first thing pharma industry is doing. That is where I began my topic, where the medical professionals were, I mean, literally looking for options. They did not know about the disease. Pharma industry came with multiple options to them. Anything you want, you are not depending on any country. Tons and tons of azithromycin, doxycycline, B supplements, and you want anything antiviral. The latest antiviral approved by US FDA. Next week, it is manufactured in India, thanks to the international company and the Indian companies working together. So these are all the disruptive things I seen in the last 2 years, which has literally put India on the top of the patients and the healthcare mind, healthcare professionals' mind. Coming back to the future ahead, just you, since you want me to touch, anyhow, I have time more, but I want to tell you that this kind of disruption is going to happen in pharma industry more. we are part of 4.0 now. So all automated workforce are expected in pharma. Everything is becoming digitalized today. And earlier itself, we had lot of data, but we don't have time for analytics of data. Today, because of the Internet of Things and the automated other digital tools, we are going to have critical data analysis, and it will be shared across the health channel. See, a new drug coming in antiviral, we have so much of Internet of Things, and we are good at IT. All data on whatever side effect, toxicity, pharmacovigilance, it is completely transformed across the chain. And most importantly, in supply chain, all this digitalization is going to make a lot of change, and we'll be having planning perfect inventory, because today a lot of expiry is going, inventory management, supply chain with temperature control, and everything is possible because of the digitalization and other automated tools. This India in pharma industry is now coping up. I feel this pandemic has made, otherwise pharma industry is a conservative industry to adopt digitalization, whereas this pandemic has made pharma industry to adopt digitalization faster by default. As Koshiaji said, this virtual platform of conference, doctors to pharma industry communication started through digital. These are all a new thing which we never thought 2 years before. Because of this pandemic, pharma industry adopted digitalization faster, which is going to help us with more specific right information at the right place. Raw data will be available to everyone. Lot of disruptive technologies is going to come in the next, say, decade, and so that India will become a leader once again in pharma. Right now, we are at 11th position and third in terms of volume, but definitely in value also we are going to grow, and we are going to bring a lot of new molecules to the community. That's going to happen. With this, I'll finish my opening remarks, and I'll wait for the next chance. Thank you.
Thank you, yes, Ilanji, and thanks for highlighting the role of IT. The adoption of IT in the pharma sector has greatly accelerated in these times. And you have talked about how the pharma industry has responded to newer and newer drugs. I think India had the advantage compared to many other countries, which had to be dependent on several other countries for imports, licensing, and various other issues. So hats off to the whole industry actually, and thanks for highlighting these aspects. And let me request our next esteemed speakers, Dr. Subhash Mandal, who is an expert in the regulatory affairs, uh, and he is vice president and chairman in the Indian Pharmaceutical Association. We will request him to talk about what are the regulatory uh, uh, changes which have happened in the last 2 years, and how is like seeing the future of regulations in the pharma sector. Over to you, Subhash.
Thank you. Thank you, Dr. Gupta. At first, I would like to thank Dr. Gupta and his team for giving us this opportunity today to be with you as share my views on the topic transformation through disruption, especially on pharma industry. Already, my good friend and colleagues, Dr. Pusia and Mr. Joycelan has already mentioned most of the issues on this topic. Uh, I would rather say that due to disruption during the COVID-19 has given us the opportunity for the pharmaceutical industry to make transformation in every sector of the pharmaceutical industry. Actually, during the COVID-19, the entire society, including pharma industry, was disrupted due to lockdown. The lockdown, and people were dying due to lack of availability of proper medicines and vaccines to prevent COVID-19. And at that time, already properly mentioned by Mr. Joycelan, that doctors were searching for options on the treatment as well as prevention of COVID-19. So our pharma industry has reacted aptly at that time and made it available for the society and given the respite of the society in spite of several odds at that time. Uh, though at the time the India was strong in vaccine manufacturing, but COVID-19 necessitated invention of COVID-19 vaccine within a short period of time. Earlier, we used to believe and have the experience for developing one vaccine. It needs more than 10 years. But we don't have that much of time to get a vaccine to wait for the dying of our citizens. So government were reacted properly and on time. They have changed their policy, which is conducive to develop new drugs as well as the vaccines. They have uh, adopted the new policies and amended the new drug and clinical trial rules, which allows overlapping of different phases of clinical trial for shortening of the trial duration. This is one of the great steps that has been taken by our regulators, and thanks to Dr. Kosiaji, they also reacted properly and on time. And these change of amendment also allowed omission of local trial provisions. What is that? That if any vaccine developed and approved in developed, countries like US, European Union, and Japan, that could be approved in our country without going through the long trial, local trial. So using these sort of advantages developed by policy decisions as well as the amendment of drugs rules, the and these rules also helped to adopt the new technologies. This also utilized by our companies like Bharat Biotech and Zydus Cadila. They have developed their vaccines with new technology indigenously developed in our country. And Bharat Biotech has developed a vaccine which is a inactivated vaccine. And this was the resultant of a joint effort by Bharat Biotech and Indian Council of Medical Research. This is one unique example that one government agency can hold the hand of a private entrepreneur and they can develop a new technology. And the other example is the Zydus Cadila. They have developed Zycov B, which is a DNA plasmid vaccine, and this is a development by Zydus in the is the first in the this world in development of this vaccine of its kind. So there are several development in the different corner. Let us see about the growing focus on innovation, intervention, and therapies. This was the development during this disruption and transformation. Due to price competition, there is a drop in generic market, which boosted biosimilar industry of India. India has already approved about 100 biosimilar till October 2020, with another 40 plus in the clinical development stage. This is in contrast to just 26 approved biosimilars in US and 61 in the European Union by August 2019. Well, this also helped Indian industry to develop in terms of biologics and biosimilars, and Indian industry expected to reach 12 billion US dollar market by 2025 in terms of biologics, with a great growth rate of 22% during 2019 and 2025. Whereas the global market showed that its amount is 268.51 billion US dollar in 2020, with a great growth rate of 12%. Similarly, in terms of biologics, it is expected that the biosimilar industry will reach 633 million US dollar in India with a CAGR of 11% between 2021 and 26. Uh, this is all development due to transformation. And the another important area of disruption as well as the transformation is the supply chain in terms of pharmaceutical industry. The supply chain was disrupted due to lockdown during COVID-19 pandemic. Major challenges were faced due to restriction or of interstate movement of medicines, other essentials, and movement of laborers, non-availability of ancillary services such as packaging material, courier services, etc. And we can give take one example that air freight charges increased from 2 US dollar per kg to 5 to 6 US dollar per kg during this time. And the average cost of shipping containers from China to India increased from 750 US dollar to 1200 to 1300 US dollar during the first and second second wave of pandemics. So industry reorganized their supply chain, the supply chain infrastructure. Many pharma companies recognized manufacturing to produce high in demand. Rapid digitization enabled business to survive during the pandemic and especially for the supply chain. Digitizing the supply chain helps organization make data-driven decisions, ideally real time, which eliminates scope for human error, which resulted a transformation in digitization, and it resulted the adoption of virtually supply chain processes. The data available from every node of supply chain analytics tool processes to develop better insights on operations and supply chain. The entire supply chain has developed. The use of cloud-based IT architecture enables rapid computing of data across all nodes of the supply chain. Collecting, storing, and translating data in the cloud ensures accessibility to all via multiple databases. These are all development during COVID and as a result of COVID pandemic. The automation in manufacturing of medicines resulted effectiveness and downtime improvement. Robotics are replacing human risk tasks like packaging of mixing chemicals and reducing human errors. The use of digitally enabled warehousing and distribution facilities. For example, the RFID tags in warehouse allows automated picking system and scanning drones provides inventory information. For distribution, RFID tagged storage cabinets and pillboxes enables automated restocking of drugs. These are all due to this transformation which necessitated during this COVID pandemic. So, a well-balanced transformation in the first COVID perspective is required. When the COVID-19 crisis hit, society was in a receive mode and adopted an emergency short-term perspective and blindly adopted the first available digital alternative such as e-commerce to continue all activities. In the post-COVID world, society must adopt a more long-term, more thought-out process. Let us come to a conclusion of this few minutes discussion. The disruption resulted transformation in terms of new technology, new business model, or policy decision that improve therapy and create value for patient and society in a way that could not be achieved throughout other means. This is all about my opinion. Thank you very much.
Thank you, Dr. Subhash Mandal. Thanks for highlighting how uh, fast our industry has actually adopted to the change, and the industry has shown a lot of resilience. And you have talked about how government and the private sector have actually collaborated in such a big way in these troubling times, and which lays the foundation for more future collaborations in the sector. So let me request our next esteemed speaker, Dr. Shah, who is an expert in the sector and who is a renowned figure in the industry, and who is the director and chairman of the Montage Laboratories Private Limited, and he is also a part of the Gujarat State Board of the Indian Drugs and Manufacturing Association. So, welcome, Dr. Shah. Your views, please. Please unmute yourself. Yeah.
Yeah. Am I audible now?
Yes, yes, yes.
Yeah. Respected Dr. Koshia, Dr. Mandal, Jaisalanji, Dr. Gupta, and all the organizing team and all the participants from the pharma fraternity. Good morning to all of you, and thank you very much for giving me the opportunity to share my views at Elite Pharma Leadership Summit. This is my first experience to speak at Elate's platform, and the topic is transformation through disruption. It is a very interesting topic, and not only from pharma point of view, but it is also very important from all the sectors across the globe. Let me correlate this topic with the two epics of Indian mythology, that is Ramayana and Mahabharata. According to the mythology, there are three major gods in Indian mythology. Brahma, who is the creator of this world; Vishnu, who is the sustainer or the administrator or the preserver; and the Shiva, who is the destroyer of this Brahma. However, majority of the people worship only two gods, that is Vishnu, who is the god of transformation, and the Shiva, who is god of disruption. Perhaps our forefather were knew that creation is not possible without disruption, and creation is not valuable if it is not transformative. So both Shiva in the form of Hanuman and Vishnu in the form of Ram played their role in transformation, forming existing ecosystem in Ramayana. Hanuman disrupted the region and Rama transformed it. Whereas in Mahabharata, Ashwatthama from Kaurav and Hanuman from the flag of Arjuna destroyed the kings on both the sides, while Krishna transformed the world order. Both Ashwatthama and Hanuman are considered incarnation of the Shiva, while Krishna is avatar of Vishnu. So historically, even Yug transformation happened backed by the disruption. Same way in industry setup, creating something new without disrupting in human is humanly impossible. So disruption is very much necessary for the transformation. People love status quo, and until disruption happens, no one creates something distinctively new which can bring transformation. So our human nature is as such very rigid. We are not ready to adopt any changes. But at the same time, when it is forced implementation, then immediately we become flexible to adopt the changes, and that is the transformation. When everyone has highlighted about the transformation during the COVID period, just imagine an officer who is sitting at the home during the COVID time, uh, and during the routine life, he is not even taking glass of water for himself. It is served by someone. But during COVID, he has even mopped his house. He has also, sweep his house. That is the transformation he has brought in himself. He has also understood the value of family. He has also understood value of each and every member of the family. Even simply the maid who is coming every day at home, his value or her value is also being understood by the family. So that is the transformation. Transformation is irreversible, whereas changes are reversible. A person who is a smoker can become non-smoker. That is the change. But again, non-smoker can become a smoker. So change is reversible, whereas transformation is non-reversible. For an example, caterpillar can become a butterfly. That is the transformation of caterpillar from the butterfly. But butterfly cannot become a caterpillar. Same way, Mohandas Karamchand Gandhi, who became Mahatma, that was the transformation, because Mahatma is not going to become a normal Mohandas Karamchand Gandhi. So transformation is very much obvious, and it is going to be there in the world time to time, but it will always be there when disruption is there. Without disruption, transformation will never be valued. So before economic disruption, no one thought of free economy. Now India is thriving after opening up economy. Before COVID disruption, no one opted for a scalable transformation in education. Now almost everything in education is digitalized. We all have experience, and even at present moment also we are experiencing it. And for the future, before Google disruption, no one imagined transformation of information ecosystem. So transformation through disruption is not really possible without disruption. Transformation is not possible without disruption. Business disruption to any innovation within an industry that radically and lastingly changes the way all companies in that industry operates. So transformation in pharma industry is coming very fast, and everyone has to adopt it. Without that, for example, Dr. Koshia has given an example of the FDC of Gujarat. They have done a wonderful work, and now 80% of the office is running online. There is no need to go into the office, apply online, get everything online. They are also going towards the paperless administration. So that is the transformation. It is irreversible. Again, I am telling you, this is irreversible. So that is the best example. In the same way, in pharma industry, if you see, there are so many things which were, schedule M, when it was implemented in somewhere 2004-5, that was the transformation of the pharma industry. People were not flexible to adopt new changes of the schedule M, particularly small and medium scale industries. But when it was forced, people started implementing it, and that was the transformation as far as quality manufactured by the pharmaceutical MSME industry was improved to great extent by implementing Schedule M. The same way, one more transformation is going to come, and Indian pharma industry has to comply with the international standards, because government is desperate to become member of PICS. So that transformation will also lead to the improvement of pharmaceutical industry in India. Um, Let us take a simple example of capsule manufacturing. Capsule manufacturing, typically it is filling of the powder into the capsule shell and closing the capsule shell. Now the mixing were required, because when you have more than one ingredient, or if you are using any fillers along with the drug, it requires mixing of the proper mixing of the those powders, and then it is being filled into the capsules. But now the transformation is, you are getting ready granules with the particular requirement, particular dose requirement. Simply put the granules in the hopper and fill it into the capsules. Now, this is also a transformation, and almost all the drugs are available in the granular form. So the operation has become easier. It has become, sure short in terms of technology and the content. It has reduced energy. It has reduced requirement of the manpower. So transformation is always, when we take it in positive, it is a very good thing, and it is going to happen from time to time. Now, in terms of the liquids like ORS, which is ready to drink liquid, if you take example of the buttermilk, if you take examples of the ready juices, they are available into Tetra Pak. Now, you just look at the past. That was, it was available either in the, when you go to a shop, they will serve you the juice in the glass, and you have to drink it over there. or it was packed into the plastic bag and it was served. But now Tetra Pak is one of the transformation. So that is the change. Same way, there are so many technological changes in terms of IT. This we never thought of having so many online meetings, so many online educational seminars, webinars, and now we have adopted it. So it is a big transformation. As in previous speeches, Dr. Kosha said that he was flying here and there in almost every 15 days or every week for the meetings. But now it is very comfortable. We were supposed to start at 9:30 and we joined at 9:20, and we will be free by within after 10 minutes. If this would have been a physical webinar, then we would have to spend entire day. So this is the transformation, and for the transformation, the industry has to be agile, adaptable. Industry needs to be agile, adaptability. So one has to be very, very much ready to adopt this kind of the changes. Apart from pharma, there are some examples of transformation. Earlier, hotel booking was very difficult when it was to be done physically. So we had to find out the phone numbers and we were booking it through the phones. But now everything is available online. Globally, you can book your hotels from the online platform. So Netflix is one of the example of the OTT platform. There is no every now movies are also being released on the OTT platform like Netflix. So this is all from my side. This is transformation is going to be there, and whenever there is a disruption, there will be transformation, and we have to be ready to adopt the transformation throughout the life in every field. Thank you so much for giving me the opportunity.
Thank you, Dr. Shah, and you have so well highlighted the transformation not only in the pharma sector but the overall life has transformed in last 2 years, especially. And thanks for correlating with the Ramayana and Mahabharata. And I think that is a imaging correlation that unless there is a destruction, creation cannot happen. So we have had the opening remarks from each of our esteemed speakers, and I think they have been very deep, and each of you have touched upon various aspects of it. We will now go into the last phase of it, where I will specifically ask you that how are you seeing the uh, future of the pharma industry, and especially in the sector you are operating in. And let me request Dr. Koshia to speak about the pharma sector in Gujarat, that how it has evolved over the years, and how it is what is the vision of the Gujarat government for next few years.
Yeah. So yes, it's a very good question by Dr. Gupta. Yes, because as I mentioned that we are dealing with the farm industry, life science industry, it's science industry, it's a technology-driven industry, and there is a lot of new things happening day in day out in the technology, and industry has to take this technology advantage in their R&D, in their operation, in their distribution, and serving the humankind. So yes, this has to play a key role in future time. And right now, we have a lot of chemical entities, and I think in future I'm looking for. I think global is looking for this shifting from chemistry to biology, and I think we have a more biological product to cater the need of healthcare in the future. We have during this COVID pandemic, there was a lot of hue and cry for tocilizumab injection. It's a monoclonal antibody to suppress the immune system while the COVID this attack is on peak in the human body. So this monoclonal antibody, this biological molecule, these large molecules and biosimilars is going to be a future of the formulation of the healthcare in the coming years. And Dr. Mandal right mentioned that there are a lot of biological molecules driven by DCGI. There are a lot of biological molecules are in pipeline, And I think India has also taken a lead in this biological field, and a lot of new biological entities are approved by this as a new drug as compared to chemical in the last decade also. So I'm looking that this technology-driven industry, this artificial intelligence, all these things will take a further step, which will help the humankind to ease their life, their longevity, comfort life, and make this world pain-free. That is what I'm looking for. Yeah.
Sir, you wish to highlight any specific policy incentives or any specific programs of the Gujarat government where like to encourage or drive the industry, any incentives are being provided?
Yes, yes. In Gujarat, because as a FDA commissioner, we are a regulator. Our main focus is to weed out the black sheep operating in the market and safeguard the public health by ensuring the safe food and the pharmaceuticals moving, produced, and available within the my territory. But yes, Gujarat government, we have a industry department, always support the industry. Yes, we have a biotechnology department. They have a policy. They have a some incentive to push this biotech sector in the state of Gujarat. And yes, we have a tri-party agreement with leading vaccine manufacturers of India along with the Gujarat Biotech Mission, and they are developing and working very closely. And there are a lot of good things are happening in this biological sector in the state of Gujarat.
Thank you, Dr. Koshia. Let me request our next speaker, Mr. Jay Seelan, to specifically talk about that. If you like, mentions like some of the stats with some data about the growth of the pharma industry in last few years and how is the projections for next few years, and how is the industry will be shaped up, especially in the context of Atma and Nirbhar Bharat, which the government is propagating that Indian all the sectors of the economy have to get more self-reliant. So, like if you have any data or projections about these issues, over to you.
Yeah, we all know Indian pharma industry is one of the recession-proof industry, which is consistently growing. Last 25-30 years, we are growing by double digit. And if you see, Indian pharma industry is the second highest industry in terms of foreign direct investment. And pharma is the product which is going to more number of countries than any other commodity or service from India. These are all already Indian pharma industry has achieved. And we are expecting by 2025 will be by 2030 will be about $130 billion, which we may surpass also. That depends on if at all we are bringing, like how fast we brought a vaccine during this pandemic. Regulators played a vital role, industry played a vital role, government support was there. If this continues, we will be able to launch say 3-4 new molecule in the global market. 130 billion and all we will surpass. Each product can be 20-30 billion dollars. So that is possible. I'm expecting, since we have already got address the gap between the different faculties. Now we'll be able to push it across, and we'll be able to bring a new molecule, which is there according to me the one opportunity. Now you talked about self-reliance. India is already, if you see in terms of formulation, uh, during independence, around 95% or 90% of products were imported for our own treatment. Now, almost 90%, 85 to 90% of drugs we are depending only from the individual, independent, Indian industries, right? Hardly some patented drugs we are collaborating or we are importing, or some biological segment drugs we are importing. As Mr. Mandal said, biologics is another area where we are constantly concentrating, and I'm expecting a lot of growth there also, along with medical devices. Formulation industry has already grown in generic space. In biotech and medical device, I'm expecting a lot of growth in the next 10 years. Then coming back to the government support or schemes, what you want me to tell on that is that PLI scheme is available where the government wants the Indian companies should be independent on China particularly. We have identified the critical APIs or intermediates around 53 products for which government is giving extra incentives so that I'm expecting in next 3 to 5 years our dependency on China will drastically come down in terms of API. So this is a very good initiative. And in terms of state government initiative also from Tamil Nadu is going to come for with a pharma park where cluster of 40 pharma industry would be there, and they are coming with a common ETP, common quality control lab, and common warehouse. This will be announced in June. So that is also is happening. So I'm seeing central government, state government, Gujarat, lot of things happened earlier. Now also it's happening. Tamil Nadu, it started. All India central government is giving PLI schemes. Indian industry, if you see the achievements, whatever we did, India as a pharmacy of the world, there was a very less contribution from the government earlier. Without that, the industry has achieved that position. Now, government is also giving a lot of scheme support. I am feeling together we are going to excel. Whatever projections we are keeping in front of us, we'll excel. There's a good scope for pharma. Thank you.
Excellent inputs. I think your point about the PLI scheme is a very, very important scheme which is going to help the sector immensely. And the government and the private collaboration is actually engaged in this times, and it will be really helpful. Dr. Subhash Mandal, your remarks on the how are you seeing the future of this industry, and especially like as you handle the regulations, like how are you seeing the government industry collaborations working out, both at the central level and also at the state level? Please unmute, Subhash.
Thank you, Dr. Gupta. This may be a little bit repetition of my earlier speakers, their views. I am very much optimistic that India will grow with a very high speed for making India Atmanirbhar in case of manufacturing and developing in the area of APIs, which is now it is lacking. Uh, India has already established himself as a pharmacy of the globe because of the industry's strong credential in formulation development capabilities, trained workforce, reputation in international market. But we were lacking in the area of innovation and development of new drugs and vaccines. But this COVID period has shown that the Indian industry and the scientists have their ability to develop new technology in terms of developing vaccines and new drugs. Uh, with this, uh, this our country will be successful in developing in the area of biologicals and biosimilars. I have already given you the statistics how we can expect the development of biologicals and biosimilars. And now the government is also supporting and encouraging the industry with different schemes uh, to make our country Atmanirbhar. There are three schemes existing at this moment. The already mentioned that PLI scheme. This industry can be utilized these PLI schemes and they can grow. Similarly, government is also developing medical device and API park in different areas of our country to make our country independent of developing APIs and the key starting materials. So I feel the future is bright for our entire country in terms of pharmaceuticals, especially in the area of innovations and new drug development. Thank you. This is my opinion.
Thank you, Dr. Mandal. Uh, Let me go to Dr. Shah, like, who is a leader in the industry himself. So let me ask him that what are the challenges you are like seeing before the pharma industry, and how they will be overcome. Over to you, Dr. Shah. You are a mute, sir.
What are the challenges? What is your question?
What are the challenges being faced by the pharma sector in India? They might be like any challenge from regulation, financing, imports, or anything else. And what are the ways to like deal with it, according to you?
Fine. So first of all, the big challenge at present we are facing is dependency of API for the API on China. That is one point. But as Atmanirbhar Bharat government is boosting up for making the API at our site, and recently, as per the report of Gujarat government by Dr. Kochia, there are 280 new plants have been licensed in last 2 years, wherein almost 40%, that is 115 plants are of API coming up in Gujarat. So, as Dr. Jaisilan has said, pharma is going to be Atmanirbhar as far as API is concerned, and dependency of China will be reducing. Second thing is, I don't know how logical my comment is, but when you want to export your product to various countries, now almost all countries are asking for their own inspection. So that is, very time consuming as well as cost. A big cost is involved into the inspection, submission, and everything. So there should be some mechanism, or there should be some regulations that if you are holding X certificate, Y certificate, or Z certificate, you will be open to export in any of the country. Like, US FDA has its own standard, UK MHRA has its own standard. But apart from these 4 or 5 regulated countries, there is a very huge market, and most of the pharma industries are dependent on that as far as exports are concerned. So these kind of issues of getting the plant inspected from each and every countries are becoming very difficult. And the third and most important thing is fluctuation in input cost, and frequently changing government policies on some of the issues are major challenges faced by pharma industries.
Sure. Uh, Excellent inputs you have raised here, Dr. Shah, and I hope that these inputs will uh, put in our like report of this event and submit to the various officials of the government, and maybe if they are thinking about these issues and they are resolved. And uh, we are at this closing of the session, and let me hand over this session to my colleague Garima, who will announce for the uh, vote of thanks and certificates. Yeah.
Thank you. Thank you so much, sir. And thanks to our esteemed speakers who could join us amidst their busy schedules and share their vision and insights about the pharma sector. It was wonderful listening to your thoughts, sir, and we do hope that we could come up with recommendations that can be shared with the respective authorities for taking further action that is needed. We would like to apprise our August gathering and to our delegates about two of our upcoming in person events scheduled for the month of June. We will be organizing the 10th Healthcare Innovation Summit on the 22nd and the 23rd of June at Eros Hotel, New Delhi. We will also be having a parallel event, which is the third Radiology and Imaging Summit, also on the 22nd and 23rd of June at Eros Hotel, New Delhi. We would like to welcome all the delegates and all our gathering to join us during our upcoming events. And as a token of thanks and a little appreciation from the organizers, we would like to present a certificate to Dr. H.G. Kosha. Thank you so much, sir. It was wonderful listening to your insights during this summit. Dr. Subhash Singh Mandal, thank you so much for joining us, sir. It's always a pleasure to have you over and listening to your thoughts. Dr. Shrenik Shah, thank you so much. It was insightfully, it was insightful. It was a learning experience to have you with us and to listen to your thoughts. And Mr. J.D. Silan, thank you so much, sir. It's always a pleasure to have you amongst us and share your thoughts with us. Thank you so much. And thanks to all the gathering for your invigorating thoughts and insights. Thank you so much.
Thank
Thank you very much.
Thank you.
Thank you.
Thank you so much for joining us. Thank you.